I'm so glad you're back. It's Jeannie with Study Nurse IQ. Continuing our cardiovascular review, we're now diving into one of the most critical parts of nursing care: diagnostic tests. This is where we learn to put on our detective hats and use laboratory results to figure out exactly what's happening in the heart and vessels. This video is packed with essential lab values, the ones that are guaranteed to show up on your exams and in your practice. Stay tuned until the end for a quiz designed specifically to test your NCLEX readiness on these lab concepts. Now let's start with the heart attack labs, the cardiac enzymes. These are the immediate code alert labs. Cardiac enzymes are proteins and enzymes that are normally inside the heart muscle cells. When the heart muscle is damaged due to a lack of oxygen, ischemia, these contents spill out into the bloodstream. Cardiac enzymes, CK globin troponin. We track 4 main enzymes, but one is the absolute gold standard. Let's start with creatine kinase MB. This is an enzyme found mostly in cardiac muscle. The MB part makes it slightly more specific to the heart. The lag time. It starts to become elevated about 3 to 6 hours after the damage begins and stays high for approximately 2 to 3 days. Normal, we want to see 0% CKMB. If it's elevated, it suggests heart muscle damage. 2 myoglobin. What it is: a protein found in both the heart muscle and the skeletal muscles. The problem: because it's found everywhere, it is not specific to the heart. If your patient ran a marathon yesterday, their myoglobin could be high. The benefit: it is the fastest to rise, becoming elevated just 2 to 3 hours after injury, making it useful for very early screening, though less definitive. Troponin T and I, the gold standard. Troponin is the true VIP. It is the most specific marker for identifying cardiac muscle damage. If it's elevated, you know the damage is definitely in the heart. Normal values. These levels are supposed to be extremely low, almost zero. For example, troponin T should be under 0.1 ng/milliliter, and troponin 1 should be under 0.03 ng/milliliter. Any elevation is a major concern. The timing is key. Troponin becomes elevated 2 to 3 hours after the damage, similar to myoglobin. However, its staying power is what makes it so valuable. Troponin T stays elevated for up to 2 weeks. Troponin 1 stays elevated for about 1 week. This long elevation means we can use it to diagnose a heart attack days after the patient initially felt symptoms. Next, let's look at risk factor labs, the numbers that reveal who's at risk before a crisis happens: lipids and blood pressure. These labs tell us about the patient's long-term risk for cardiovascular disease and atherosclerosis. Cholesterol and triglycerides. Cholesterol is essential for the body, but too much of the wrong kind is what leads to plaque buildup. Total cholesterol. We want this number to be under 200 milligrams per del. This is the lousy cholesterol, the one that deposits plaque in your arteries. Goal: under 130 milligrams for the average person, but often under 100 milligrams or even lower for high-risk patients. HDL, high-density protein. This is the happy or healthy cholesterol, the one that scavenges LDL and brings it back to the liver to be removed. It's protective. Goal: we want this number to be high, over 55 milligrams for females and over 45 milligrams for males. Triglycerides. These are fats in the blood that are also risk factors. The expected ranges vary slightly by gender, but should generally be kept under 150 milligrams per deciliters. Blood pressure. Blood pressure is the force of the blood against the artery walls. Controlling it is the key to preventing strokes, aneurysms, and heart failure. Normal. Systolic should be under 120 and diastolic under 80. Prehypertension. This is your warning zone. Stage 1 and Stage 2 hypertension. This is when we start to get aggressive with medications and lifestyle changes. A quick note on ranges. Just be aware that the exact numbers for classifying prehypertension and the different stages can vary slightly between your textbook, your professor, and different medical organizations. Focus on the trend. The higher the number, the more critical the situation is. In NCLEX, if a number is truly abnormal, it will be clearly out of range, not right on the border. The plumbing and volume labs. These labs assess the quantity of blood cells and the ability of the blood to clot. Hematologic labs includes red blood cells, platelets, GB, and HT. We must check the basic building blocks of the blood. RBC, red blood cells, 4.2 to 6.1 million cells. Range varies slightly by sex, with males typically having a slightly higher range. Platelets, the clotting fragments. The normal range is 150,000 to 400,000 per mm. If they are too low, the patient is at risk of bleeding, too high, and they are at risk of clotting. HGB hemoglobin and HCT hematocrit, these are always reported together. Hemoglobin, the protein within the RBC that actually carries the oxygen, 12 to 18 grags per milliliter, slightly lower for females. Hematocrit, the percentage of blood volume made up by RBCs, 37 to 52%, slightly lower for females. Pro tip, the 3-to-1 rule. Hematocrit is typically about 3 times the value of hemoglobin. For example, if HGB is 14, HCT should be around 42%. This is your quick check to see if the lab results are consistent. Coagulation labs, PTI number. These are used to monitor anticoagulant therapy and check for clotting problems. APTT, activated partial thromboplastin time. What it measures: the intrinsic pathway of the clotting cascade. When we use it to monitor clients receiving heparin therapy, normal 30 to 40 seconds. Therapeutic range. When a patient is on heparin, we expect this time to be 1.5 to 2 times the normal range, e.g. 45 to 80 seconds. PT, prothrombin time, and INR, international normalized ratio. What it measures: the extrinsic pathway of the clotting cascade. When we use it to monitor clients receiving warfarin-coumadin therapy. PT normal, 11 to 13 seconds. I normal, about 1. Therapeutic range. This is the most crucial number for warfarin. We typically aim for a range between 2 and 3 for most anticoagulation needs. If the INR is too low, they are at risk of clotting. If it is too high, like 4 or 5, they are at risk of bleeding. D-dimer. This measures a fragment released when a fibrin clot is broken down. Very low, usually under 0.4 per milliliters. Significance. If the D-dimer is elevated, it is highly suggestive that a clot has formed somewhere in the body and the body is trying to break it down. We use this as a screening tool for conditions like DVT, deep vein thrombosis, or a PE, pulmonary embolism. The heart failure lab. Brain natriuretic peptide is your key to diagnosing fluid overload in the heart. Next, we have HBNP, human B-type natriuretic peptide. This is a hormone released by the ventricles of the heart in response to excessive stretching caused by fluid overload. The message: when the heart is overloaded with fluid, as happens in heart failure, the ventricles literally stretch out and they release BNP to signal the kidneys to get rid of the extra volume. Normal should be under 100. Significance: if the BNP is over 100, it is highly suggestive of heart failure. The higher the number, the worse the fluid overload and the severity of the heart failure. You've just learned the major cardiovascular lab values, from enzyme timing to clotting times. Now, let's test your understanding with 3 NCLEX-style questions. Question 1. A client arrives in the emergency department reporting chest pain. The nurse receives the following lab results. Troponin 1.5, normal value is less than 0.03. Myoglobin 70, normal is less than 90. Based on these results, which conclusion is the most accurate? A. The client is unlikely experiencing a myocardial infarction, MI, because the CKMB is 0%. B. The client's chest pain is due to skeletal muscle damage, as myoglobin is slightly elevated. C. The elevated troponin 1 confirms that the client has experienced cardiac muscle damage. D. The nurse must wait for a repeat troponin draw in 6 hours before notifying the healthcare provider. C. Rationale. Troponin is the most specific marker for cardiac injury. Any elevation above the normal threshold, regardless of the CKMB or myoglobin results, confirms that cardiac muscle damage has occurred, indicating an MI. The nurse should notify the provider immediately, not wait for a repeat draw. Question 2. The nurse is reviewing the lab results for a client receiving warfarin-coumadin therapy. Which value is the most appropriate indicator for adjusting the client's medication dosage? A. 65 seconds. INR of 1.5, CHGB of temp 5, DD dimer of 1.2. B. Rationale. The INR, International Normalized Ratio, is the gold standard for monitoring warfarin Coumadin effectiveness and guiding dose adjustments. A therapeutic INR range is typically 2 to 3. An INR of 1.5 is subtherapeutic, too low, indicating the patient is at risk of clotting and likely needs a dose increase. APTT is used for heparin. Question 3. A client with a history of heart failure is admitted with shortness of breath and peripheral edema. The nurse anticipates that a blood sample will be drawn for which diagnostic lab to confirm the current status of the heart failure. Option A is troponin T, B BNP B-type natriuretic peptide, C LDL cholesterol. D is PT-INR. Answer B. Rationale. BNP is the key laboratory indicator for heart failure and fluid overload. It is a hormone released by the stretched ventricles of the heart. An elevated BNP confirms ventricular overstretching due to increased fluid volume. Amazing work getting through these essential cardiovascular labs. These numbers truly tell the whole story, from the heart's emergency signals, troponin, to long-term risk factors, LDL, and fluid status, BNP. Now that you know how to interpret the labs, you're ready to move into one of the biggest topics in cardiovascular nursing, coronary artery disease, CAD, and how to tell the difference between angina and a myocardial infarction, MI. If this teaching was valuable, please like, comment, and subscribe to Study Nurse IQ for more simple, visual, and powerful nursing lessons.